Hello and welcome to Cure Cloud, the place where we talk about real health challenges with honesty, compassion, and science. If you're watching this, chances are you or someone you love is dealing with pericarditis, a condition that can turn your life upside down. Today's video is for you. We're going deep into what pericarditis really is, what it feels like, how it affects your daily life, and what you can do to manage it. Whether your pain started suddenly or gradually, whether it's been misdiagnosed or dismissed, this video might finally make you say, "Yes, that's what I've been feeling." So if you find this video helpful, don't forget to subscribe to Cure Cloud for more science-backed health insights, especially if you're also dealing with kidney issues, liver problems, obesity, or sleep apnea, conditions that often overlap or contribute to pericarditis. Let's begin. Pericarditis is inflammation of the pericardium, the thin, double-layered sac that surrounds your heart. Think of it like a soft protective envelope that holds your heart in place and prevents it from overexpanding. It also lubricates the heart so it can move and beat smoothly. When this sac becomes inflamed, it can cause intense chest pain, pressure, and even shortness of breath. There are different types of pericarditis. Acute pericarditis comes on suddenly and lasts less than 6 weeks. Chronic pericarditis can last for months. Recurrent pericarditis means it comes and goes. Constrictive pericarditis is a serious form where the sac becomes stiff and scarred, affecting the heart's ability to fill properly. Science shows that many triggers exist. These include viral infections like COVID-19, Epstein-Barr, or influenza, autoimmune conditions like lupus or rheumatoid arthritis, post-heart surgery inflammation, cancer treatments, trauma, and certain medications. In some cases, kidney failure or hypothyroidism can also play a role, and in up to 90% of cases, the cause is unknown or idiopathic. Let's talk about what it feels like. The chest pain from pericarditis is often sharp, stabbing, and localized behind the breastbone or to the left side of the chest. It typically gets worse when lying down and improves when sitting up or leaning forward. This position change is a key clinical clue. People also report radiating pain to the left shoulder, back, or neck, shortness of breath, low-grade fever, heart palpitations, and overwhelming fatigue. Some describe it as feeling like a heart attack. Others say it feels like pressure that won't let go. The fear it causes can be worse than the pain itself. One patient shared, "Every time I felt a twitch in my chest, I panicked. I couldn't sleep, couldn't eat, and I kept Googling symptoms." This condition isn't just about physical symptoms, it impacts your life. At work, you may feel too tired to concentrate. Brain fog becomes your daily reality. Long meetings feel like a marathon. You might call in sick more often or feel pressure to push through when your body is telling you to rest. At home, relationships may suffer. You feel guilty for needing help or canceling plans. Others might not understand what you're going through. "You don't look sick" becomes a phrase you hear often. Exercise becomes intimidating. You want to walk or jog, but you're scared of triggering pain. Even bending down to pick something up can cause discomfort. This fear is real. The anxiety of not knowing if the pain will return affects your mental health. Pericarditis is not just inflammation, it's a disruption to your entire rhythm of life. So, how do you deal with it? Treatment usually starts with NSAIDs like ibuprofen or aspirin to reduce inflammation. Colchicine is commonly added to reduce recurrence. If these don't work, corticosteroids may be prescribed. However, steroids come with risks and must be tapered slowly to prevent rebound flares. In some stubborn or autoimmune-related cases, medications like anakinra or rilonacept, biologics that target interleukin-1, have shown promise. These newer treatments are often used in cases of recurrent or chronic pericarditis. Recent studies from the American Heart Association have shown that interleukin-1 blockers can reduce recurrence dramatically in difficult-to-treat patients. Lifestyle changes play a critical role. Rest is essential during acute flares. Stress reduction through deep breathing, mindfulness, and therapy can help. Eating an anti-inflammatory diet rich in omega-3 fatty acids, turmeric, ginger, berries, and dark leafy greens supports healing. Good hydration, avoiding alcohol and smoking, and gentle movement like stretching or walking are key. Avoiding overexertion is crucial. Medical monitoring matters. Regular echocardiograms help detect pericardial effusion, fluid buildup around the heart. In rare cases, this fluid puts dangerous pressure on the heart, called cardiac tamponade. This is a medical emergency. Now let's talk about the emotional side. Pericarditis can feel isolating. People may not believe your pain because it's invisible. You might feel like a burden to your family. You might be afraid to make plans, afraid to drive, afraid to sleep. You may even start questioning yourself. It's okay to grieve your old self. You're allowed to feel angry, confused, and overwhelmed. But know this: healing is possible. With time, knowledge, and the right support, you can regain control. This is why it's so important to talk to your doctor clearly. Keep a journal of your symptoms, when they start, what worsens them, how long they last. Bring it to your appointments. Ask questions like, what is the likely cause of my pericarditis? How can I prevent recurrence? Are there autoimmune or viral markers I should test for? Can I safely exercise, and when? What are the signs of a complication? Don't leave until you feel heard and understood. Now let's explore related conditions. Sleep apnea, especially obstructive sleep apnea, causes repeated drops in oxygen and spikes in blood pressure. This increases strain on the heart and raises inflammation, potentially contributing to pericardial irritation. Liver disease, especially non-alcoholic fatty liver, is associated with systemic inflammation that can affect the heart. Elevated liver enzymes can signal inflammation is more widespread than we think. Kidney problems, especially chronic kidney disease, increase waste buildup in the blood. Uremic toxins can irritate the pericardium and increase the risk of inflammation and fluid retention. Obesity contributes to a chronic state of low-grade inflammation. It also increases pressure on the heart and lungs, adding mechanical stress that can worsen symptoms. So if you're dealing with pericarditis, it makes sense to check your whole body health, get your sleep assessed, check kidney and liver function, talk to a nutritionist. Every piece matters. Let's now do a quick FAQ. Can pericarditis come back? Yes. Recurrent pericarditis happens in up to 30% of patients after the first episode. Is pericarditis life-threatening? Not usually, but complications like cardiac tamponade can be dangerous and need emergency care. Can I exercise again? Yes, but gradually. Only return to activity when inflammation has resolved and your doctor clears you. Does it mean I have heart disease? Not necessarily. Pericarditis is inflammation of the lining around the heart, not the heart muscle itself. Now let's bust a few myths. Myth: pericarditis is just anxiety. Fact: while anxiety may worsen symptoms, pericarditis is a real physical condition with measurable inflammation. Myth: you can't treat it. Fact: most cases resolve with treatment, and newer medications offer hope even in difficult cases. Myth: if tests are normal, nothing is wrong. Fact: inflammation can exist even when EKGs or blood tests are inconclusive. Clinical judgment matters, so if this video spoke to you, leave a comment below. Let us know what you're feeling or ask a question. Your story could help someone else feel seen. And don't forget to subscribe to Cure Cloud for more content on heart health, chronic inflammation, sleep apnea, kidney and liver care, and real-life strategies to help you live better. You are not alone. Healing is not linear, but it is possible. Thank you for being here. Be kind to yourself, and we'll see you in the next video.